Have you ever felt that quiet uncertainty while sitting in a hospital waiting room, wondering if everything behind the scenes is truly prepared? One of my patients once shared how calm the doctor sounded, yet how many questions she carried home with her. I want you to imagine this for a moment, a hospital that looks orderly on the surface, while complex systems work silently to keep everyone safe. I am Dr. Evelyn Carter, and I have spent decades caring for older adults across many healthcare settings. When we hear about rare viruses like Nipah virus, it is natural to feel uneasy. Nipah virus is not a household illness, and it is not something most hospitals encounter every day. That is exactly why conversations about infection control matter. This video is not about fear or headlines. It is about understanding how hospitals prepare, where challenges can quietly appear, and why readiness is a process rather than a promise. In my clinical experience, hospitals are very strong at managing common conditions. They do this well because practice builds confidence. Rare viruses test a different kind of readiness. Infection control is not just gloves and masks. It is training, communication, and systems that must work together even when a threat is unfamiliar. Science shows that preparation improves outcomes, not because danger is higher, but because calm systems respond better under pressure. For older adults, understanding this topic is empowering. It helps you ask thoughtful questions and feel protected rather than anxious. Knowledge does not increase fear, it gives you steadiness. When you know how infection control works, you can trust the process more deeply. If this conversation feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support allows us to continue offering calm, trustworthy guidance made especially for you. In the next part, we will gently explore why hospitals can struggle with rare viruses and what preparedness truly looks like without urgency or alarm. For now, take a breath. You are here to learn, not to worry, and that is exactly where understanding begins. Why hospitals struggle with rare viruses. As someone who has spent many years walking hospital corridors and sitting beside patients and families, I have learned that most healthcare systems are built around what they see every day. Hospitals become very good at treating conditions they encounter often. Heart disease, infections like pneumonia, complications from diabetes. Repetition creates familiarity, and familiarity builds confidence. This is not a weakness. It is how medicine stays reliable and efficient for millions of people. Rare viruses like Nipah challenge that structure in a quiet way. They do not appear often enough to shape daily routines. Because of that, they rarely influence how budgets are set or how staff training is prioritized. Hospitals must make careful decisions about where limited resources go. Time, staffing, and funding are finite. When a virus is uncommon, it naturally moves lower on the list, not because it is unimportant, but because it feels distant. I have seen this pattern repeatedly. Infection control teams are highly skilled, yet they are often stretched thin. Training sessions focus on what staff are most likely to encounter during their shifts. A nurse or technician may work an entire career without seeing a single case of a rare virus. Without regular exposure, preparedness becomes theoretical rather than practiced. Science supports this reality. Studies on emergency readiness show that skills not used regularly fade faster, even among experienced professionals. There is also the human factor. Hospitals are busy environments. When patient volume is high, attention naturally shifts to immediate needs. Rare threats can feel abstract compared to the very real patients waiting for care. This does not mean hospitals are careless. It means they are human systems responding to constant pressure. From my perspective, this explains why conversations about infection control should be grounded in understanding rather than blame. Hospitals are not failing. They are operating within constraints that most people never see. Recognizing this helps us ask better questions and have more productive discussions about readiness. For older adults, this awareness matters. It reminds you that preparedness is not a switch that is either on or off. It is a spectrum that improves with planning, practice, and honest evaluation. Knowing this allows you to feel informed instead of alarmed. When you understand why gaps exist, fear loses its grip, and trust becomes more realistic. This foundation helps us move forward calmly. Understanding the structure behind hospital readiness sets the stage for deeper insight into what infection control truly involves and how systems quietly adapt over time. What infection control really means. When people hear the phrase infection control, many picture masks, gloves, and signs on hospital doors. Those visible details matter, but they are only the surface of something much deeper. Infection control is not a single action. It is a way of thinking that shapes how a hospital functions every day. At its core, infection control is about breaking chains. Germs spread through contact, through air, and through shared spaces. Hospitals work quietly to interrupt those paths before they reach vulnerable patients. This starts with hand hygiene, which remains one of the most powerful tools in medicine. Simple hand washing reduces transmission more effectively than many advanced technologies. Science has confirmed this again and again, yet it works only when practiced consistently, even during the busiest moments. In everyday hospital life, infection control shows up in small decisions. A nurse cleans equipment between patients. A room is left empty for proper air circulation after a procedure. Staff follow specific steps when moving from one patient to another. These actions are not dramatic, but together they form a protective rhythm. When that rhythm is steady, patients rarely notice it at all. From my own experience, I can tell you that infection control is strongest when it becomes habit rather than reaction. Hospitals that practice these principles daily respond more calmly when something unusual appears. When routines are well established, teams do not panic. They adjust. This is why preparation matters even when a rare virus is not present. Older adults benefit the most from this quiet consistency. As we age, our immune systems respond differently. Recovery takes longer, and small infections can have larger effects. Infection control is not about isolating people or creating fear. It is about preserving safety without disrupting dignity. Understanding infection control helps families feel grounded. When you know that protection comes from many small, thoughtful actions rather than dramatic interventions, uncertainty becomes easier to manage. This understanding prepares us to look more closely at where systems can weaken and why those weaknesses are often invisible until they are tested. Where gaps can appear, infection control systems are designed with care, yet even the best systems can develop quiet gaps. These gaps are rarely the result of neglect. More often, they appear in places that feel routine, familiar, and therefore easy to overlook. In medicine, repetition can sometimes soften our sense of urgency, especially when nothing has gone wrong for a long time. One common gap emerges during transitions. A patient moves from one department to another. A shift changes and new staff take over. Information is passed along quickly, sometimes verbally, sometimes through electronic notes. Most of the time, this works well. Occasionally, small details are missed. In the context of infection control, even a small delay or misunderstanding can matter, not because danger is immediate, but because consistency has been interrupted. Another quiet gap appears when systems rely too heavily on memory rather than structure. Healthcare professionals are highly trained, yet they are also human. Fatigue, long hours, and emotional stress can affect attention. Science shows that checklists and standardized routines reduce error, not because people lack skill, but because systems support them when focus fades. When these supports are incomplete or outdated, gaps can widen silently. I have also seen gaps form when protocols exist, but are rarely practiced. A policy may be written clearly, yet if it is not reinforced through regular drills or discussions, it becomes abstract. In calm times, this feels harmless. When a rare situation arises, hesitation can follow. This is not failure. It is a natural response to unfamiliar circumstances. It is important to approach these observations without blame. Hospitals are complex environments with thousands of moving parts. Pointing fingers does not strengthen infection control. Understanding systems does. When we analyze where gaps appear, we create opportunities for improvement that protect everyone. For older adults and their families, recognizing these silent gaps brings perspective. It explains why preparedness is an ongoing process rather than a guarantee. Awareness does not mean danger is present. It means systems are alive, learning, and capable of becoming stronger with attention and care. Hospital preparedness versus emergency reality. Hospitals are filled with plans. There are binders, digital protocols, and carefully written procedures that describe exactly what should happen during an emergency. On paper, these plans often look reassuring and complete. They reflect thoughtful work by teams who want to protect patients and staff. Yet there is an important difference between preparedness as it is written and preparedness as it unfolds in real life. In an actual emergency, conditions are rarely ideal. Time feels compressed. Information arrives in pieces. Staff may be pulled in several directions at once. I have witnessed moments when a plan was technically followed, yet the emotional weight of the situation changed how people moved and communicated. That difference matters. A protocol does not feel stress. People do. From my own experience, the most challenging moments are not caused by a lack of knowledge. They come from the need to adapt quickly. When a situation is unfamiliar, even well-trained professionals must pause to orient themselves. This pause is human. It does not mean care is compromised. It means reality is asking more than the plan anticipated. Science supports this observation. Research on emergency response consistently shows that systems perform best when they are flexible. Rigid plans can struggle when details shift. Hospitals that practice adapting protocols rather than memorizing them tend to respond more smoothly. This is especially important when facing rare threats, where no one has recent experience to lean on. For older adults, this distinction offers reassurance. Preparedness is not a promise that everything will be perfect. It is a commitment to respond thoughtfully, even when conditions change. Understanding this helps families see hospitals as living systems rather than machines. When we recognize the space between planning and reality, we also recognize the value of practice, communication, and trust. These elements do not live on paper. They live in people. That awareness prepares us to consider how pressure on healthcare workers influences readiness and why support for those workers is essential to patient safety. Healthcare workers and system pressure. Behind every hospital system are people who carry its weight day after day. Doctors, nurses, technicians, and support staff bring skill and dedication to their work, yet they also work within limits that are not always visible to patients. Staffing shortages, extended shifts, and constant demand place steady pressure on even the most committed professionals. Long hours affect more than energy levels. Research shows that fatigue can subtly influence attention and decision-making. This does not mean healthcare workers become careless. It means their ability to maintain the same level of focus over time requires strong system support. When staffing is thin, fewer people are available to double-check procedures or step in when someone needs a moment to reset. Over time, this strain can affect readiness, especially for events that require extra vigilance. Training is another area shaped by pressure. Continuing education takes time away from patient care. Hospitals must balance the immediate needs of today with preparation for less common scenarios. When schedules are full, training on rare viruses can feel distant or optional. I have seen skilled professionals want to learn more, yet struggle to find the time and space to do so meaningfully. Extended shifts also influence communication. When teams change frequently or work under stress, information must travel quickly. Most of the time it does. Occasionally, important context is shortened or assumed. Infection control relies on clarity. Even small misalignments can weaken the chain of protection. From a clinical perspective, this is why readiness cannot be separated from workforce well-being. Systems are only as resilient as the people who operate them. Supporting healthcare workers through adequate staffing, realistic schedules, and ongoing training directly strengthens patient safety. For older adults, understanding this connection can bring empathy and calm. It reminds us that preparedness is not only about rules and equipment. It is about caring for the people who care for us. When those caregivers are supported, readiness becomes steadier and more reliable. As we talk about hospital readiness and the quiet systems that protect patients, I want to pause for a moment in a very human way. Over the years, I have learned that understanding health is not about memorizing facts. It is about feeling steadier when questions arise. Many of the people I care for tell me that what they want most is not dramatic reassurance, but clarity that helps them breathe a little easier. That is why conversations like this matter. When you take time to learn how infection control works and why systems sometimes feel stretched, you become a calmer participant in your own care. You notice patterns. You ask thoughtful questions. You trust your instincts without letting fear guide them. This is especially important for older adults, whose health journeys often include many appointments, many decisions, and many moments of quiet uncertainty. Knowledge becomes a companion rather than a burden. I also know that watching a video like this takes time and attention. You chose to be here, and that choice says something about how deeply you care about your well-being or the well-being of someone you love. That care deserves respect. It deserves information that is measured, honest, and grounded in experience rather than alarm. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. This invitation is not about numbers or algorithms. It is about community. When people who value calm understanding gather in one place, conversations change. Fear softens. Questions become clearer. Support feels closer. Every time someone shares a video like this, it reaches another person who may be sitting with quiet concerns late at night or before an upcoming appointment. I want you to know that this space exists for you, not to rush you, not to pressure you, simply to walk alongside you as you learn. The more we understand together, the more confidence replaces uncertainty. That confidence strengthens not only individual choices, but the way we engage with healthcare as a whole. Why seniors are more vulnerable. As we grow older, our bodies change in ways that are both natural and predictable. These changes are not signs of weakness. They are simply part of how the human body adapts over time. One of the most important shifts happens within the immune system. In younger years, immune responses tend to be fast and robust. With age, that response becomes more measured. It still works, but it may take longer to recognize and respond to unfamiliar threats. This does not mean older adults are constantly at risk. It means the body prioritizes balance over speed. Science has shown that immune cells in older adults communicate differently, often producing less inflammation. This can be beneficial in many situations, as excessive inflammation can harm tissues. However, when facing a new infection, a slower response can allow symptoms to develop more gradually. That is why early recognition and steady infection control are so valuable. There are also physical factors to consider. Skin becomes thinner. Mucous membranes dry more easily. These barriers play a role in preventing germs from entering the body. Changes in circulation and lung function can also influence how the body handles stress and recovery. None of this is cause for alarm. It is information that helps explain why protection matters. From my clinical experience, I have seen how thoughtful environments support older adults remarkably well. When infection control is consistent and calm, seniors often fare better than expected. Their bodies respond best when stress is low and routines are familiar. Fear can disrupt sleep, appetite, and healing. Understanding vulnerability in a gentle way allows us to reduce that fear. For families, this perspective is reassuring. It shifts the focus away from danger and toward care. Vulnerability is not about fragility. It is about recognizing where extra attention makes a meaningful difference. When hospitals understand this, and when patients understand it too, protection becomes collaborative rather than frightening. This awareness prepares us to talk about how families can support seniors during hospital visits, not by worrying more, but by engaging with care in a thoughtful and confident way. What families should understand. When a loved one is in the hospital, it is natural for families to feel the urge to do everything possible. That instinct comes from care, not fear. Yet in my experience, the most helpful actions are often the simplest ones. There is rarely a need for extreme measures or constant vigilance. What matters most is understanding the situation clearly and engaging with the care team thoughtfully. Families do not need to become medical experts. Hospitals are filled with professionals whose role is to manage infection control and patient safety. What families can do is stay informed in a calm way. Asking how infection control is handled in a specific unit or what precautions are in place is reasonable and welcomed. These questions signal partnership, not distrust. I often encourage families to listen as much as they speak. When a nurse or physician explains a process, take note of how they describe it. Confidence and clarity usually reflect well-established routines. If something feels unclear, asking for clarification is appropriate. Simple questions often lead to reassuring answers. It is also important to remember that anxiety can travel quickly within families. Older adults are sensitive to emotional cues. When family members appear worried, patients may feel unsettled even if they are physically comfortable. Calm curiosity creates a different atmosphere. It supports healing rather than tension. From a clinical perspective, families who approach care with steady understanding tend to feel more satisfied and less overwhelmed. They trust the system while staying engaged. This balance reduces stress for everyone involved, including the healthcare team. Understanding does not mean controlling outcomes. It means participating wisely. When families know what infection control looks like and why certain steps are taken, uncertainty softens. Questions become productive instead of urgent. That mindset supports better communication and a more positive hospital experience for older adults and those who love them. This steady approach helps us appreciate how prevention can exist without panic, and how thoughtful awareness strengthens care rather than complicating it. Prevention without panic. Prevention works best when it is calm. In medicine, the most effective protective measures are rarely dramatic. They are steady, practiced, and grounded in evidence. Panic does not improve outcomes. It often interferes with clear thinking and good communication. This is why understanding prevention as a quiet process is so important. Science supports this approach. Studies on infection control consistently show that routine measures, when applied consistently, reduce risk more effectively than sudden reactive actions. Hand hygiene, appropriate protective equipment, and clear isolation procedures create layers of protection. Each layer may seem small on its own, but together they form a strong barrier. These steps are not new, and they are not alarming. They are familiar tools used every day. From my experience, calm environments help everyone function better. Healthcare workers make clearer decisions. Patients rest more easily. Families communicate more thoughtfully. When people feel rushed or frightened, mistakes become more likely. Calm allows systems to do what they were designed to do. Older adults benefit greatly from this steadiness. Stress affects the body in measurable ways. It can raise blood pressure, disrupt sleep, and slow healing. Prevention that respects emotional well-being supports physical recovery. This is why fear-based messaging can be harmful, even when intentions are good. Understanding prevention without panic shifts focus from what might happen to what is already being done. It encourages trust in established practices while leaving room for improvement. This balance is powerful. It keeps attention on safety without amplifying worry. When science and calm work together, safety becomes sustainable. Preparedness feels reassuring rather than overwhelming. This mindset prepares us to reflect on what readiness should feel like, not as an emergency alarm, but as a steady presence that supports care every day. What readiness should feel like. When we talk about hospital readiness, many people imagine alarms, emergency drills, and constant tension. In reality, true readiness feels very different. It feels quiet. It feels steady. It feels like a system that knows what to do without needing to rush or raise its voice. In my years of practice, the safest environments were rarely the loudest ones. They were the places where routines were clear, communication was respectful, and everyone understood their role. Readiness is not about expecting disaster. It is about being grounded enough to respond thoughtfully when something unfamiliar appears. A prepared hospital does not look frantic. It looks organized. Staff move with purpose. Questions are answered calmly. Adjustments are made without drama. This kind of readiness is built slowly, through practice, reflection, and trust between teams. From a scientific perspective, this makes sense. Systems that function well under stress are systems that have rehearsed calm responses. The nervous system works the same way. When people feel safe, they think more clearly. Hospitals are no different. A culture that values steadiness creates better outcomes than one driven by urgency alone. For older adults, this definition of readiness is especially important. Safety does not come from fear, it comes from predictability and reassurance. When patients feel that the environment around them is stable, their bodies often respond more positively to care. Healing is not only physical, it is emotional as well. Families often ask me how they can tell if a hospital is ready. My answer is simple. Pay attention to how information is shared. Notice whether staff seem supported rather than rushed. Listen for consistency in explanations. These signs matter more than any headline. Readiness should leave you feeling informed, not alarmed. It should invite trust, not tension. When hospitals aim for this kind of preparedness, infection control becomes part of everyday care rather than a source of anxiety. That is the kind of readiness worth striving for, and the kind that truly protects those who need it most. Thank you for staying with me until the end. Your time and attention matter more than you may realize, and I am grateful that you chose to spend these moments learning and reflecting together. As we close, I want to gently remind you of something important. Hearing the phrase "hospitals are not ready" does not mean danger is near. It does not mean you should feel afraid or uncertain about your care. What it truly means is that readiness is a living process, one that improves through awareness, patience, and steady effort. Understanding this allows worry to soften rather than grow. For older adults, correct understanding brings calm. It replaces fear with perspective. When you know how systems work and why they continue to evolve, you feel more grounded. You are not left imagining worst-case scenarios. You are supported by knowledge that steadies the mind and the body. Over many years of caring for seniors, I have learned a simple truth. The body responds best when it feels safe and respected. Healing is not only about medicine or procedures. It is about trust, dignity, and the quiet reassurance that you are being cared for thoughtfully. When stress is lowered, the body often finds its own strength more easily. If information ever feels overwhelming or noisy, remember that you do not have to carry it all alone. Senior Health Daily is a place to return when you want clarity without pressure and guidance without fear. I hope you will continue this journey with us, at your own pace, whenever you need a calm and steady voice.